Good morning. I want to welcome each of you to our annual Resiliency Symposium, and also those who have tuned in to Facebook Live. Let's begin with a moment of silence for those that have lost their lives in an act of terrorism or mass violence, and for their families, responders, and those who survived. I want to begin today by thanking our sponsors for hosting both coffee breaks in the morning and later on this afternoon, and also our lunch break. So that is Matthew McCauley of Turk and Heath and McCauley, Michael Boucher of Boucher and McGarry, the law firm of Kreindler and Kreindler, the law firm of Motley Rice, and the law firms of Spicer Krause. So thanks so much to all of our sponsors for helping us feed you today. So again, I want to welcome you to the Resiliency Symposium. The goal of our annual symposium is to bring together a diverse group of individuals to share information and lessons learned and bridge the gap between research and practice. Today you'll hear from accomplished researchers, clinicians, victims advocates, and government agencies, and victims' families who lost their children in Newtown and Parkland. In the audience, we have representatives from Newtown, Parkland, 9/11, the Boston Marathon, and many have traveled as far as Canada, this group over here to the left, Florida, Washington, D.C., California, Texas, and Boston. So thank you for being here. And I want to welcome you also tuning in to Facebook, through Facebook Live. So I'd like to talk a little bit about the organization and update you on where we are today. When we founded the organization in 2001, our mission was to provide support services for the victims' families, responders, and survivors to commemorate the 2,977 lives that were lost. And more recently, we're working with many of our partners here in the room to share lessons learned to communities impacted by other tragedies, both here in the United States and abroad. After any tragedy, the first priority is assisting the victims' family members and the survivors. 17 years after 9/11, there's been a rippling effect through the broader community. Over 400,000 people survived the attacks and tens of thousands responded. So we really, from the beginning, thought more broadly about the 9/11 community. I was a social worker on 9/11, and so our organization is fundamentally based on social work practices, and it's really influenced the work that we continue to do today. We recognized early on that individuals grieve differently and in their own time, so still today it's crucial to meet them where they are in their journey. We did a lot of advocacy work, and I'll talk about that a little later on this panel this afternoon, but there's still outstanding issues. You may not be aware, but there's over 1,100 families that have never been notified of remains, so that process continues on. And of course, the reference I made to the responders and survivors, they are really struggling with medical and psychological conditions due to their exposures in the aftermath of 9/11. Over the last 17 years, we've provided over 160,000 hours of social service support and a broad range of support services. We provided services for 5,100 9/11 families, responders, and survivors. We've hosted, this is our 27th conference, and dozens of workshops over the years. And we collected and contributed 25,000 photographs of the victims. And working, our staff went to hundreds of communities and met with over 1,600 families to collect those photographs, which are now, we've also shared them with the museum, and it's a core component of their in memoriam exhibit. About the 5th anniversary, we realized too that there were, these events seemed to be happening more frequently. And we realized there were no best practices, or was certainly no model for creating the organization that we've, Voices of September 11th, and what it's become today. So we received a grant from the Office for Victims of Crime, and we traveled to Oklahoma City, Virginia Tech, Northern Illinois University, and Tucson, Arizona, and we interviewed hundreds of victims' family members, people that responded in law enforcement, the fire department, the hospitals, and so forth, and developed this resource kit. And you'll see there were similarities in all of those communities in the immediate aftermath, what's needed. And so we really feel strongly that we have to be more proactive in our approach. And then we took that training and realized too the long-term mental health needs. And so we incorporated, not just for the victims' families, but also for those who responded and survived, and created a 2-day training that incorporates considerations in providing mental health support. Although we couldn't have anticipated on 9/11 the long-term needs of 9/11, nor 17 years later the serious consequences the responders and survivors would have due to their exposures to the toxins in Lower Manhattan. But over time we recognized the long-term support services and the wide range of resources that are needed for some, and most important, the connection with others that is critical to their recovery. There's many myths about someone that's gone through a trauma, and a few of these I'd like to share. The needs of families are short-term and time-limited. That is not the case for some. Time heals all wounds. When you lose someone in a shooting or an act of mass violence or a terrorist attack, you never fully recover. You move forward in a much different way. And life doesn't return to normal. It's very different. And not that it's necessarily all bad, but it's very different. Over the last 6 years, we've worked with our outreach partners to promote the World Trade Center Health Program, which is providing medical and mental health treatment to the thousands of responders that are in the program and the survivors as well. Today, over 40,000 are currently in treatment for very serious mental health conditions and life-threatening illnesses, including most cancers. And sadly, 2,000 have died of 9/11 related illnesses, leaving families who have needs as well. So when you think about the community, the broader community, mental health, it just impacts every community. And so it's a range of, from PTSD, anxiety disorder, panic attacks. There were quite a few suicides after 9/11, and I'm seeing that happening after other events as well. But then you have to think about the service providers, the people, like the people on the left here, that work in so many communities after these events, and the care that they need. And we'll talk about that later as well, just how important it is for them to be able to have the support that they need so they can continue to do their job. We received a grant from the Kanishka Project, and in March of 2017, we completed a research project, and we interviewed, it was a quite long survey that families participated in 600 9/11 families, and several dozen Air India families participated in the study. And we found that of those that we interviewed, these were the three trajectories. Some people, were definitely impacted at the event, and you see on the lower level that they have been able to, over the course of the years, sometimes even have post-traumatic growth. Others are impaired from time to time, and sometimes it's other events that happen that cause, again, those mental health issues along the way. But we're seeing 15 years later, there is a part of the population that is still highly impaired with mental health complications. And I want to share with you some of the thoughts that I have related to that. We're currently, through Public Safety Canada, following up with some of the findings of that research project. And we're going to be interviewing hundreds of families to better understand the circumstances around those findings. And it's my opinion that when people's needs are met in the immediate aftermath, when they have the support, when they have the guidance, when they're connected with others, they can have a very different outcome. But when you look at 9/11 and you see that the memorial opened in 2014, the terrorist trial is still going on. I don't know that will ever come to resolution in our lifetime. And of course, as I mentioned, the 1,100 families who have never been notified of remains, and they have a new DNA process now where 17 years later they think they're going to be able to make those identifications. And the opposite of that really is the people that have really been able to move forward. Certainly their life has been impacted, by an unimaginable tragedy, but they've been able to move forward and to help other people through the foundations that they've established in the organizations. And we're finding that in our research that can lead to a very different outcome. So I just want to conclude with this thought, and that healing is a journey, and we have very distinguished guests, and I'm going to be introducing one of them shortly here, that they're going to be sharing their expertise with you today, their passion for their work and their stories.